Greetings, everyone. My name is Amy Fischl. I'm a dietitian and diabetes educator at the University of Chicago, and I am going to talk to you very briefly today about nutrition and diabetes prevention. So just let's set the stage here and just talk about how diabetes is such a global emergency, and it's not slowing down anytime soon. So if we look at this IDF Atlas information, it is something that we already know, but we need to start doing something even prior to diabetes diagnosis. Now, taking a deeper dive into diabetes prevention and impaired glucose tolerance, 127 million people in the world have impaired glucose tolerance, so 1 in 14 adults. So we know that we need to start doing something sooner rather than later, and education is going to be the most important piece for these folks to reduce their risk of developing diabetes sooner. Now, just looking at the United States information, we know that 84 million people have prediabetes, and we have plenty of data of what we can do to slow that progression down. And looking at all of the prevention, the different prevention interventions around the world, this information has paved the way for our roadmap of how to prevent diabetes and how to disseminate that information to the population. When we take a look at the US DPP, lifestyle alone has the biggest impact on reducing the risk of diabetes. So we know that just looking at the initial DPP study, they were reducing their risk by 58%. Now, that was achieved by having those subjects following a lower calorie meal as well as increasing physical activity. So two pieces that you're going to be hearing over and over. And again, we know that these are cornerstones for the care of reducing risk of diabetes, but we need to have practical methods to be able to disseminate that to the populations. And when we look at all of the key messages and recommendations for preventing diabetes, they all have similar outcomes. You know, we know that the type 2 is largely preventable, not necessarily in the long term, even if we look at DPPOS data. However, in the short term, we can reduce it from starting sooner. But again, we do need to focus on that nutrition advice. And again, I know that it's not rocket science, but this does require hand-holding to make people have these behavioral changes so they could be successful. And so we know that reducing calories and reducing weight are going to reduce their risk of diabetes. Again, as healthcare professionals, it's impossible to be able to do this in the construct of a visit with your patients. So that's where having a registered dietitian nutritionist or a diabetes educator to see these people is going to lead to better outcomes. Now, we know that within the United States, there have been some varying information about coverage of insurance. However, when we look at dietitians across the US, this is a largely something that can be used, and the insurance is covering these folks to be able to see a registered dietitian. So it's important that people understand that there are a lot of methods to actually help prevent, but it does take a village. Everyone needs to be involved with having this happen. Now, the American Association for Clinical Endocrinologists have been publishing guidelines for prediabetes since 2008 and then updating it every 3 to 5 years. And of course, lifestyle management is the cornerstone for all prevention efforts. And if we take a look at what needs to be done, and so again, building on all of those prevention interventions around the world, the guidelines are all the same. We know that we need to reduce the weight of these folks by 5 to 10%. But again, how do we do that? Again, exercise and reducing calories and helping people to understand. Diet, while we think of it as such an easy component, it's not as easy for people to follow. And so again, having some additional professional guidance to help reduce their calories, modify how they're eating, to do that without making it so difficult for these folks. But it certainly is about calorie restriction. Now, within the ACE guidelines, there are two different algorithms that are available. So again, we see the prediabetes algorithm, and of course, just highlighting that lifestyle therapy is the cornerstone of care. And then taking a deeper dive into the risk stratification, really just highlighting the nutrition goals. So again, gives a really nice just overview of what should be followed. But if we take a look at that the box on the right, is that structured counseling is a very, very strong component to see outcomes. Now, the role of the dietitian, again, cannot be stressed enough, that we know the value of having a dietitian seeing folks for a variety of chronic conditions, but just looking at diabetes prevention, we know that anywhere from even 2 to 12 visits were associated with a reduction in weight, in BMI, in waist circumference, fasting glucose, total and LDL cholesterol, as well as triglycerides. So again, making just modifiable changes could help reduce other medications as well. And again, it's cost savings when we look at the long run, because we're again reducing that risk of other complications that could be happening. Now, looking at a review of 69 articles, we know, as we've said previously, that lifestyle interventions are effective. And the dietitian, but again, even having a wellness instructor or health educators that are trained by dietitians are going to have very similar effects. And again, it's all about the weight loss. If we can have weight loss, then we're going to be seeing a reduction in many other issues that are going to kind of ensue with diabetes, prediabetes, hypertension, cholesterol. So again, we have plenty of evidence that, again, it is long-term though. If you take a look at the duration of many of these interventions, we're talking anywhere from 3 to 36 months. So again, this isn't a one and done. And that's one thing that we do have to understand, that it is ongoing. So when we look at the Academy of Nutrition and Dietetics, it's kind of the mothership of dietitians, the position statement that was just published looking at individuals at high risk of type 2, this is just kind of the guidelines of what the dietitian should be doing. And again, it really is prescribing a meal plan to support weight loss, looking at individualizing their care. So what kind of adjustments, are they not eating enough fruits and vegetables? And so increasing those macronutrients. Of course, increasing fiber and whole grain food. Then, of course, this is everyone's goal, to increase physical activity. And certainly it's about behavior change. And so the dietitian is in a prime position to be able to help with this. And again, it's ongoing. And so again, a covered benefit for most insurance plans, as I mentioned, can certainly aid all physicians and nurse practitioners, PAs, that don't have the time to be able to really delve in and spend 45 minutes to help somebody make these changes to their meal plan to have some lasting effect. Now, there are a multitude of free resources that are available for people, and I highly recommend that you take a look at all of them. Again, as I said, referring to an educator or a dietitian, I want everyone to do that, but again, in a pinch, just to be able to give patients something to just get the ball rolling, the Academy of Nutrition and Dietetics, eatright.org, has some nice information on just chronic disease prevention. The Diabetes Care and Education Practice Group has a free publication that can be downloaded about prediabetes, and the Diabetes Care and Education Practice Group is a group within the Academy of Nutrition and Dietetics, and they only focus on diabetes. So again, just a nice reference for all of you to take a look at. And then finally, the National Diabetes Education Program, while they have a multitude of free resources, this is one of my favorites, the Choose More Than 50 Ways to Prevent Type 2 Diabetes, because they're nice 50 bite-sized things that people could actually do to affect change as well. Now, I would be remiss if I didn't talk about the National Diabetes Prevention Program and the CDC funded program that is available. And again, we are getting Medicare recognition for this and coverage. But I mean, certainly this is the this is what everything is kind of built on when it comes to the ongoing education to reduce the risk of diabetes for folks. But again, the one thing is finding a program within your area, going to the CDC website is great, because then you can send your folks to these already recognized programs to get this ongoing education for your patients with prediabetes. But for your information, again, they have some fabulous resources as well, taking a look at the participant guide that you could perhaps even use to help you just kind of have those teachable moments with folks. And again, give them very, very practical ways to make some small adjustments to their eating habits, because that's the bottom line. You know, again, we have to understand that nutrition is complex, and there is so much. It is individualized, but again, certainly just to get people started and giving them just some small ideas of how to improve what they're already doing that could be built on when they actually do see a professional, nutrition professional or a diabetes educator to be able to help them really fine tune it to their needs and their goals. So just wrapping this up, again, the nutrition, it could be something that we can talk about for days, but again, just a very small little bite sizes that we wanted to talk about today is that we know that lifestyle has the biggest role in preventing diabetes, but it has to be an ongoing process. So again, it's really important that we understand that, and helping patients to understand that education, it can be a covered benefit for them. So again, trying to identify if they could see a dietitian, but there are so many resources that are available for folks to be able to help them make small changes to have sustained goals. But certainly referring patients to a diabetes educator or a dietitian is something that I recommend for everyone to do, because again, it's so valuable to have some individualized information that is going to make them successful in reducing their risk of diabetes. And finally, if you'd like to hear more like this lecture, there's two different organizations that have some meetings throughout the year. And so this the National Conference on Prevention of Diabetes is held in Atlanta between November and December every year. So again, for more information, by all means, take a look at the website, because again, there's always a plethora of presentations that are similar to what I've been talking about, but it's going to be in a little more detail as well. And then if you feel like taking a little trip outside of the US, I'd certainly suggest there's the annual Pan-Arab Conference on Diabetes that's held every March in various Middle East countries. So again, you can get a flavor for the Middle East, which is gorgeous. So I strongly recommend that you take a look at this website as well. But thanks for listening, and everyone have a wonderful day.